Let's have some talk on the liver. Liver is the largest solid organ in the body and it is located in the right upper abdomen under the rib cage. Liver has got hundreds of vital functions in the body like metabolism of proteins and fats and carbs, detoxification, vitamin storage, regulating blood sugar levels, cholesterol, hormones, production of bile and so on. So it's much important to keep our liver healthy. I, Dr. K. Kavya, a homeopathic physician, will be talking about one serious disease condition related to the liver, that is fatty liver. When there is an increased buildup of fat in the liver, that leads to the fatty liver. Usually seen in people who excessively drink alcohol, though drinking alcohol is one of the major causes for fatty liver. Secondly, seen in people who constantly eat oily and fried foodstuffs, highly spiced and more of non-veg foods. Third cause can be lack of physical activity, especially who are leading a sedentary lifestyle. Even seen in people who are suffering with obesity, diabetes or high cholesterol or triglycerides, or people who are taking certain kinds of allopathic medications for long term. Even who are into the rapid weight loss, malnutrition, and even genetic inheritance plays a role in developing fatty liver. As I said, when there is an increased buildup of fat, that leads to the changes in the structure of hepatocytes, that is the liver cells. So these hepatocytes are filled with fatty droplets that leads to the defect in the fatty acid metabolism. In addition to it, excessively drinking alcohol damages the cellular structures of liver. Fatty liver is been classified into first one, non-alcoholic fatty liver disease. Here, the person is total abstainer or with alcohol intake less than 20 grams per day. So the 10 grams of alcohol, that is approximately equal to 30 ml of whiskey, or it is equal to 100 ml of wine. Non-alcoholic fatty liver disease is again of two types. One is simple fatty liver, second one non-alcoholic steatohepatitis. The second major classification of fatty liver is alcoholic liver disease or alcoholic fatty liver disease. Here the quantity and duration of alcohol intake are the important risk factors. So the males taking more than 60 grams of alcohol and females taking more than 20 grams of alcohol for consistent about 6 to 8 years will significantly lead to the alcoholic fatty liver disease. Progression of the fatty liver disease takes place through the certain phases. Due to some underlying causes, there is an accumulation of the fat on the healthy liver. This phase is known as steatosis. Due to the accumulation of the fatty droplets in the liver cells, it leads to the inflammation and damaging the liver cells. This phase is known as steatohepatitis. This further leads to the decreased blood supply throughout the liver and builds up the scar tissues, giving rise to the liver fibrosis phase. Fibrotic stage gives rise to the cirrhotic stage. In this stage, the liver is scarred and damaged permanently. Further, it leads to the hepatocellular carcinoma or liver failure. Even based on the deposition of fat in the liver cells, fatty liver is being divided into three grades. In the first grade, there is 5 to 33% of fat deposition in the liver. In the second grade, the fat deposition is about 34% to 66% in the liver. In the third grade, or the severe fatty liver disease, where the fat accumulation is more than 66%. Often, there are no or few symptoms. Occasionally, there may be tiredness or pain in the right side of the upper abdomen, frequent gastritis, indigestion, constipation, and so on. More than 90% of heavy drinkers, they develop fatty liver. About 25% develop more severe alcoholic hepatitis, and about 10% of fatty liver disease patient, they fall to fibrotic and cirrhotic stage. Usually, fatty liver get diagnosed on ultrasonography of abdomen, as most of the times it's asymptomatic. Once fatty liver is confirmed on ultrasonography of abdomen, further fibroscan is done to determine the exact stage of fatty liver. Fatty liver is treatable and reversible if diagnosed and treated properly. The fastest way to cure a fatty liver when in early stages is to have a healthy diet and exercise regularly. Always be careful about alcohol consumption. It's always better to avoid or quit alcohol. Foods like grapefruit, blueberries, cranberries, fatty fish, olive oil, broccoli, green leafy veggies helps in maintaining the liver healthy. Identifying and knowing the root cause for the fatty liver in individual helps in treating and curing it. Homeopathy, which is based on the principle of individualization, helps in reaching out to the root cause of the disease and curing it. Homeopathy has got great scope in curing the fatty liver disease. People who are leading a sedentary life, having sleep issues, especially sleepless nights, with gastric and constipation problems, the homeopathic medicine Nux vomica 30 really helps in curing the fatty liver disease. Even the homeopathic mother tinctures like Chelidonium majus mother tincture, Chionanthus mother tincture, Phytolacca berry mother tincture really helps in clearing the accumulated fat on the liver and helps in curing the fatty liver disease. A diabetic patient having fatty liver disease presenting with the gastric symptoms like acidity or some intestinal disorders, sore vomiting, sore eructations, then the homeopathic biochemic tablet Natrum phosphoricum 12x can be taken. People especially suffering with obesity and having certain gastric troubles, and even especially in females having problems with menses, PCOD or leukorrhea, then the medicine Calcarea carbonicum really helps in curing the fatty liver disease. Along with medicines, even strict diet has to be maintained, especially avoid excessive use of oils, fried and spicy foods, and decrease the quantity of non-veg foods. Regular physical activity and daily exercising, especially in obese patient. Weight reduction helps in burning out and reducing fats in liver to some extent. As I always say, before self-medicating any homeopathic medicines, always consult a proper homeopathic physician for your treatment, as self-medicating homeopathic medicines could be harmful. Hope this video was helpful in understanding the topic fatty liver. If you have any queries, let me know in the comment section. Do subscribe the channel KK Homeo Hub for more such informations. Thank you.